Welcome back to the Healing Wellness Show. I'm your host, Dr. Karim, and today I'm joined with Amanda, nurse practitioner at Iowa Wellness Center. Welcome back, Amanda. And today we're going to tackle a crucial and often misunderstood topic, which is functional medicine, right? So we'll explore why functional medicine isn't covered by like most insurances, why most providers aren't practicing this approach, and why patients are they're seeking it really nowadays and asking answers about healing or getting to the root cause. So stay tuned. This is an episode you'll definitely want to hear. So Amanda, again, why don't you tell us a little bit about yourself for these new viewers that haven't seen you before or heard you before?
I started my career as a registered nurse in cardiac IC. I then transitioned to pain management, physical medicine and rehab, and then started my career here in 2020 with Iowa Wellness. So we've kind of started just delving in more and more into the functional medicine world and helping more and more patients in better ways.
Thanks. Well, Amanda, let's start with just give us a clearer definition. What exactly is functional medicine?
Yeah. So functional medicine is a term being used more and more. People are hearing it. You said, what is functional medicine? And I like to explain it to my patients. It's a patient-centered, holistic approach to treating you. So it's identifying underlying conditions, finding, like he said, the root cause of the issue, what's causing the imbalances. It's an upstream approach to medicine. I say it's like an iceberg. Most conventional medicine is looking at what's above the water, whereas functional medicine is looking what's below the water, which is a significant difference. And so that really puts it in a way that they're like, okay, so it's instead of treating, the presentation, put a Band-Aid on it, treating the symptom, functional medicine is digging deeper. It's peeling the onion. It's asking a lot of whys. Why is this happening to you?
Yeah, I think it's like digging deep, like with the blood work and really evaluating a lot of things.
Yeah, absolutely.
So why do you believe functional medicine resonates so much with patients?
I think unfortunately, medicine is letting patients down. It's not helping patients. These patients are coming to me. They've seen multiple specialists. They've been to Mayo. They've been to the university. And they're not getting any answers. But more importantly, they're not getting any better. Mm-hmm. So they basically come to me. They're a mess, essentially. They've had every test drawn. They've had one doctor tell them this. They've had another doctor tell them this. They don't want to take any more meds. They're already on 15 medications. This med's causing these side effects. I mean, it's just a train wreck. And so they come to me because they want to find out, again, why is this happening to me? What is the root cause? Please help me. So that's where I step in.
So why would you say the typical insurance company doesn't typically cover functional medicine?
Honestly, I think insurance companies don't cover it because in the long run, it's not making them any money. It's just simply as that. Patients get better and they're feeling good, that's really not helping them. However, in the long run, these patients are saving money because a lot of these drugs that they're putting them on are thousands and thousands of dollars a month, and they could not, they might not need to be on these medications if we can find the underlying cause of the issue. So I think too, you have big pharma involved. It's just not, functional medicine is just not quite understood.
Do you kind of foresee that insurance companies might change their minds later?
I hope so. I really do. Insurance companies will pay for some, they may pay for this test or this stool kit or, this. I think it really just depends on the diagnosis that the patient has, what the patient's already tried, how the provider codes these diagnoses and charts these documents, what's going on. So it's not that they won't pay for anything, but most of it they won't. I think the other biggest thing is, people are going to their doctor's appointments. They may get 10 to 15 minutes with their doctor, and it's just next, see in 6 months, see in a year. So they're getting paid for that, whereas we might take an hour and a half for one appointment with our patient because that might be needed. And, they're not going to reimburse us for that. So you have to value your time too and your knowledge as a provider, and you need to be reimbursed for that. So unfortunately, that falls back on the patient, but the patient's willing to because you're spending the time and you're actually fixing the problem.
Probably why doctors aren't going into functional medicine more or opening more functional medicine practices?
Yeah, I think it's more to just a lack of knowledge. You're not taught this kind of this way of medicine, and med school, or even when I went to NP school, I like to describe it as it's putting the pill to the ill. It's how fast can you get to the diagnosis, and then here's the pill that treats that. It's pretty much how it goes.
So, what do you see as a primary misconception about functional medicine?
Some people think it's pseudoscience or quackery or, witchcraft or, that kind of stuff. But I really think that's kind of phasing out. I think patients are actually more and more becoming open to it and want to learn more about it. So I think, some of those criticisms are actually dwindling down pretty quickly.
Yeah, I mean, we see a lot of patients that come in and say, I want to get off of my medication if I can, or, I want to.
Yeah, I think patients are tired of not being heard.
Yeah.
Patients don't get to sit there with their doctor. How many times does your doctor ask you, so, you've been on this med for a year. Is it helping? How do you feel? I looked at your labs. Everything's normal. We'll see you in 6 months. Patients aren't really having a voice when it comes to their care.
And a lot of times normal isn't normal, So
I don't use that word.
yeah, so a lot of times we'll have patients go, hey, we're gonna pull a hormone lab, and they're like, oh, my doctor said it's normal. Well, we look at it and we're like, well, that's not normal.
Do you feel normal?
Yeah.
No.
So it's a lot of times when they say normal, it's because they tested their age group and they're falling within what that age group tests.
The population.
Yeah. So it's normal, but it's not normal.
Again, it's just a lack of communication and education.
So what are some major benefits patients experience when choosing functional medicine?
Being heard, I think the benefit is, they have the ability to fix themselves from the inside out. So it might take a little bit though, it's not something that's going to happen overnight, but I think once they start to kind of figure out where you're going and they like that you're it's a timeline, right? So it's learning maybe even back to before they were born, their epigenetics, timeline out their whole entire life and kind of find where those triggers may have started. And then they get excited too because they're like, oh, you're right. I had this traumatic experience here, or I underwent a lot of stress at this time. And then shortly after that is when I started getting all of this joint pain. And so they get excited too because you really start to delve into their life, and they feel important, they feel heard, and so patients are more apt to stick with something when they know you're truly trying to help them.
So what would say some common conditions or health issues that would respond well with functional medicine approach?
Well, gosh, there's a whole list, but the biggest ones I'm going to say is autoimmune conditions, because a lot of times if you have one autoimmune condition, you have multiple autoimmune conditions. And typically it starts by fixing the gut. So if you can fix the gut, that will help all of those things. Anxiety and depression we deal with a lot. There's a close connection between the gut and your brain, your nervous system, and everything works together. I want to make that piece too. Is in conventional medicine, you're a cardiologist, you treat the heart. You're a thyroid specialist, you're a joint specialist. In functional medicine, we understand that everything is communicating together. So it's not just fixing one specific piece or it's truly a whole systems approach, and you have to understand that in order for the patient to get better. Pain can be a big one that can be fixed. Thyroid issues are a big one too. So again, it's really just a whole systems approach, and when you fix one thing, it's kind of like a downstream. Everything else starts to get better. So it's pretty awesome.
So what's a typical treatment journey look like for someone new to functional medicine?
Yeah, so I think that first consult, it can take a while because like I said, we have to go all the way back from square one. We have to figure out what are the triggers, what are the antecedents, what are the modifiable lifestyle, factors that we can address. And then it's plotting everything on a matrix and figuring out, what area do we need to focus on? Do we need to focus on the gut? Do we need to focus on, stress? Do we need to focus on the fact that you don't sleep, or the fact that, whatever it may be, we have to map out the timeline. So again, it's not something that's going to happen overnight. It may take a couple months or maybe even a year for these patients to really start to come around. But once they do, it's unbelievable.
Does functional medicine replace traditional healthcare, or can it work side by side?
I think it's good to collaborate with providers. I like to play nice in the sandbox, but I think there is definitely a place for functional medicine, but I think there is a place for, if you're having an acute heart attack, you need to go to the emergency room and be seen by, that's your conventional medicine, right? So yes, there definitely is a time and place for that. It's more of an acute care, if you will, versus we kind of look at more of the chronic um, big picture. But hopefully, we prevent all of those acute
Yeah.
episodes.
Yeah. So how would a functional medicine provider collaborate with a traditional provider?
Well, hopefully you get lucky enough to find a traditional provider that will allow you to treat their patient in a way that you can both collaborate together. But unfortunately, I do get a lot of kickback. We're still in that space where, again, it's unknown. It's kind of a little bit misunderstood. But again, I think we're hopefully changing a little bit. But sometimes it can be tough to work with traditional providers because they don't understand my thinking. They don't understand my way of medicine, or they just don't care to learn. So I've really come in, to issues with that. Some of my patients will say, I got yelled at by my provider for coming to you. It's like, that's just mind blowing to me. I mean, if anything, you should want your patient to feel better and to do better. It's not a competition, So again, those kind of doctors, I don't feel like have the patient at the center of what's important.
Yeah, I feel like a lot of times when we're getting that kickback, it's usually that older provider that's in his ways. I think the newer generation providers, I think they're more open-minded. Yeah, I mean, it really all depends on the provider. If they're open-minded or if they're closed-minded, then forget it.
Yeah, I've heard it all.
Yeah.
So
So what are some limitations or challenges you see with functional medicine?
again, I think from a cost perspective, some of these tests and things can be expensive. So it can be, alternating kind of the path that we take. But it can get expensive at times. I think, most of the time, maybe just starting in the gut instead of ordering all of the tests, kind of starting with the less expensive route. But patients sometimes come in and they want to know these things. Do I have mold toxicity? Do I have Lyme's? Do I have, this, and this? So I think it's just meeting the patient where they're at, kind of finding out what their goals are. And I would say the biggest thing. And then again, the challenges of working with the traditional providers can be a little challenging because patients are kind of getting pulled one way versus the other. But in the end, they know what's best for them. And so they can make that decision.
So where do you see functional medicine heading next 5, 10 years?
Hopefully we start to get more coverage, I would say, is what I see. And more people getting on board and open to our concepts and ways of helping people, working more in collaboration with other providers. I think we're, again, just from where I started here in 2020, so 5 years ago, I didn't even know functional medicine was a thing. I'd never even heard of that. So fast forward now. So I really think we're gonna do big things in 5 to 10 years.
Yeah, for sure. So what excites you the most about the growth and acceptance of functional medicine?
I would say just the ability to fix someone from the inside out, not putting a Band-Aid on it, asking the whys, like I said, peeling back the onion and then seeing my patient get better, weaning off the medications, living a better life, being happier, healthier, just all of the things that come with that. I think it's just finding the root cause, and then, it's like a light bulb, like here it is, when all of this time we've just been bombarding them with, Band-Aids and more medications, and then finally it's like, this is why, so that's awesome to me. So everyone's their own challenge, and it's not easy, but we're gonna get to the root cause, and that's what excites me.
Yeah, I'd say, just that patient that walks in, they're in pain or down, and then you just see them progressing and that big smile at the end when you figured out what's going on with them. What's the best advice you'd give someone interested but unsure about starting functional medicine?
I say just come talk to me. I will meet them where they're at. It doesn't have to be, you have to completely change this, or you have to do this, or you have to do this. If they drink 5 pops a day, let's try 2. So it doesn't have to be such drastic changes, and we can go as slow or as quickly as the patients want. And like I said, I can meet them where they are, and we can work together. I think figuring out, like I said, that timeline of events, and kind of let the patient really talk, let them dig into this, because patients like to do that. They like to talk about themselves to, the doctor, because they want you to figure it out. So, you can really get into some deep places that, can bring out some, some things that maybe they were afraid to talk about or they didn't want to talk about, but now they are. And so you're helping them from a mental emotional state too, which plays a huge part in this. So it really is just establishing that relationship, that rapport with the patient, and then just letting it go from there. Let them lead their care.
So what's a typical treatment journey look like for someone new to a functional medicine? Did I?
Yeah, you're going the
No,
other
I
way.
had one. Oh, this
Go
one.
the other
This
way.
one. This is
Oh.
what I want. The gut health ones that we've done with losing weight.
Any that you can think of, Fishman?
I mean, we've had like Jim. He's lost a lot of weight, and that's gut health
Yeah.
and hormones and. Okay, can you share a memorable story or patient experience that illustrates the power of functional medicine?
Yeah, so one gentleman that comes to mind, he's been 6 months, 9 months. When I first sat down with him, he was distraught. He had just lost his wife. He had no idea really what direction to go. He just knew that he needed help. So he met with Dr. Karim, he met with me, we did the labs, we, kind of figured out where we needed to go with him. We got him started on a gut health program. I gave him some hormones. He started doing all of the rehab stuff with the back traction and the vibrawave and all of our neuropathy program, the IV vitamins. I mean, we had him going in a really strong direction, and now he's down probably 60 pounds. He comes in here every day because he wants to. He tells the front desk, just schedule everything out, but make it sure that I'm doing something once a day because he loves coming in here. So now we have him doing our M-Sculpt Neo, help, build his core muscles. He's doing our sauna. He's doing our infrared light. He continues with hormones with me. He continues with IV therapy weekly. Every time he comes in, he's smiling. He's happy. He absolutely loves it here. He has a new girlfriend in his life, so he has that relationship component, and he's just overall a completely different person in less than a year.
Yeah, it's like his gym.
It is.
He comes in and like his gym.
We're his nutrition coach.
Yeah.
We're his family. We're his gym. We're all of the things for him. So it's pretty awesome.
So how should listeners select the right functional medicine practitioner or clinic?
So I might be a little biased, but I'm currently going through the Institute of Functional Medicine certification program, so I will be a functional medicine certified provider. I think that's important to look for. Patients can simply Google functional medicine provider, and if you're certified, your name will come up. So make sure they're certified. That's what I think. Obviously, providers can take functional medicine courses and kind of do that sort of thing. I think, I've invested a lot of time in something like this. And so I think going to someone reputable that, can really help you is important.
It's pretty extensive. I mean,
Yes,
there's a huge test at the end. And yeah, I mean, take you about a year and a half?
About 2026, I'll be done. So yeah, about a year and a half
Yeah.
of training, and it's Institute of Functional Medicine is fantastic, very reputable. So do your research, but it's well worth it.
Well, thank you, Amanda, for sharing your knowledge again and wisdom. And to any of our viewers, if you've got any more questions, send them our way. Or if you want to come see Amanda, just schedule a consultation with the front desk, and we'll be able to kind of try and dig in and see what's going on with you. So, like we talked about today, functional medicine isn't a fad. It's the future of comprehensive healthcare, and it's personalized healing. Amanda, again, I'd like to thank you for shedding the light on this transformation approach. And if you found today's conversation valuable, be sure to subscribe to the Healing Wellness Show on Spotify, Apple Podcasts, or whatever podcast you listen to. Follow us also on social media and stay connected. Please share this episode with someone that might benefit from it. But until the next time, take care and keep exploring your path to wellness.